Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Today we're talking about obesity surgery. Now, it's estimated that over 200,000 procedures are performed every year in this country. So here to discuss her own personal experience is one of my patients. Chardelle, welcome. Thanks for joining us.
It's my pleasure.
Now, you've lost about 160 pounds in coming up on 2 years.
Yes.
How old were you when you went in for the surgery?
It was 2 years ago, so that's 61.
Take us back to before you had the surgery, your life as someone who struggled for years with obesity. What was that like?
I weighed 318 pounds, and I really couldn't walk. I really couldn't stand.
You told me your bones actually hurt, right?
Yeah, well, I guess my frame was saying enough. We just can't take any more. It was very difficult for me. If I stood somewhere, I had to lean on something. I never went in a store without getting a shopping cart, so I'd have something to lean on, to roll on.
How many years were you obese?
I would say it started when I was 20. I started to gain weight when I was like 20, and it was just a case of gaining the weight, taking it off, then slowly the weight comes back on.
Well, one thing that you and I have discussed so many times is that there are multiple causes for obesity. Obviously, there's environmental, behavioral, psychologic, metabolic, genetic.
Exactly.
So when people try to target weight loss with one approach, I think they often fall short of the mark.
It is very aggravating to anyone who's obese to have someone who is normal, not necessarily thin, but normal, saying, you know, if you just went out and walked for 5 minutes a day.
But you couldn't walk, right?
No, I couldn't walk, and they don't realize this. They don't realize that obese people really have a very tough time walking, sometimes just standing, which is where I was. I remember so vividly, the night before I went in, they had to have a last-minute x-ray. And she said, well, you can put your hand up here. And I actually had to hold onto this bar. Now, how long does an x-ray take? 30 seconds? I really, my back was screaming.
What other consequences did you have from the obesity?
I had very bad problems with my left knee. And I had cortisone shots, and it was very difficult. The pain was real, and it was 24/7 for several months.
You also had a cancer that was associated with the obesity.
Yes.
You had uterine cancer.
Yes.
What about high blood pressure, diabetes, sleep apnea, any of those
things? I had
things?
none of those. I had none of those. And unfortunately, when you have none of those, you think, I'm healthy. And in reality, I was anything but healthy. I was really in terrible shape. But I thought my blood pressure is fine. You know, I'm getting along.
And when you had the uterine cancer, were you aware that that was a consequence of the obesity?
Oh, believe me, the doctor who told me about it, one of the first things she said, and it was a shock because I wasn't the cancer had been mentioned at anything with the procedures I had. To suddenly hear I have cancer, and the next few words she said is, well, you know, your weight was a large factor in this. And there was like a double whammy, you know, like, oh, you did this to yourself. I'm sure she didn't mean it that way, but that's the way I felt about it.
Take us back and explain what the moment was like when you said, I think I'm going to do this.
My daughter Wendy kept saying, you have to do something about this. She had a business associate, a young woman, who had done this, and so she emailed me her picture and she told me about her, and she kept bugging me about this. And then I had contacted a doctor. I went to see you, actually, and you said to me, have you considered lap band? And we started to discuss it, and you said, I recommend this doctor. And I said, that's the doctor I plan on seeing.
I'm curious as to how you responded to my making that suggestion, because I feel like so many doctors might not know how to bring the topic up, or so many patients might not be willing to receive that suggestion.
Well, you know, I think if I hadn't already been thinking about it, I might have felt hurt. I might have felt a little bad about it. But I think you really need to hear that from a doctor. I think you have to have a doctor say, look, you know, this is something you seriously have to consider, because it's too frequently people think about this and then they hear stories about somebody's cousin's aunt's uncle who died, you know, or something negative about it. I think you need to hear this from a doctor so you know that it is a legitimate option.
Tell me how you decided whether to go for the gastric bypass or the lap band.
The gastric bypass is irreversible. I mean, once you do that, that's it.
Right.
And this seems like a really good idea. I mean, why would I want to go back? You know, I didn't want to reverse this. Right. And the doctor stressed that this was the gold standard. for weight loss.
Right.
And I decided that that was what I wanted.
Now, because it is a much more involved surgical procedure than the lap band, the complication rate can be higher, and there's a risk of death, of course, with this type of procedure, just like there is with any procedure. How concerned were you?
You know, I remember so vividly, 2 years ago, my husband dropped me off at the front door to park the car, and I went over and I sat down by a big Christmas tree, and this song came to mind, "Put me in, coach, I'm ready to play today," and I was just so psyched. I was so ready for it. I was really ready for it.
And how was the recovery?
Oh, the first week is not that great, but you know, if you cut your finger, the next few days are not that great, you know, anytime you cut yourself. So they give you plenty of pain medication. So, you know, you should just take the pain medication, get through the week, and that's it.
You have to make some pretty significant changes in your lifestyle and how you approach eating and food. What kind of changes did you have to make?
Generally, you're not supposed to eat more than this amount of food that fits in the palm of your hand. That's a small amount of food.
At one time.
At one time. And you should really only do that 3 times a day. But sometimes, you know, you look at it and you think, I want to eat more. But you can't. Right. Believe me, you can't.
Cannot. Now, you also probably have to get your blood checked periodically.
Yes, exactly.
And you take vitamins?
Oh, absolutely. I take vitamins. I'm very careful, and I try to make sure I'm getting the right amount of foods and the right foods.
And now you exercise?
Yes, and it's so much easier, of course, because it's not, you know, really difficult to do anything anymore.
How is your life different now? How is it better? How would you describe your new life? Because it really is a new life.
God, you know, I can get down on the floor with my grandchildren. I mean, that's amazing. I can pick them up.
Right.
I mean, you know, before that was getting to be really, really difficult. And in 2010, we're taking a trip to see the pyramids, Petra, Luxor. You know, that's going to involve a long amount of walking.
Right.
I couldn't do that if I hadn't lost this weight. I mean, I'm going to get to see the pyramids, Petra. I couldn't do that if I was still 100 pounds overweight.
What's the #1 most important thing, Chardelle, you would tell someone who's watching or listening and is considering having bariatric surgery?
Oh, I would definitely tell them to consider this. You could Google it. You can do a lot of research on the web about this. Find a good doctor and really move forward with it. Check with your insurance company, see if they'll help you, and I think almost all of them will. And actually go ahead and do it. And believe me, you know, if they told me you have to come back every year and have this done, I would do it every year.
And while obesity surgery is considered the gold standard for the treatment of morbid obesity, it is important to remember there are risks as well as benefits, and this does require a lifelong commitment to a new lifestyle. Thanks for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.